Coming up on the Doctor's Hospital podcast.
As a woman, I'm more empathetic as well.
Mhm.
And not only to my female associates, but also my males.
Bahamas is unique in that women tend to take on a lot more leadership roles. We're better educated.
I think it's important to kind of detach from work and just kind of lose yourself in something different.
At Doctor's Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctor's Hospital, trusted and best care now.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. And I am pleased today to be hosting a very, what I imagine to be a very interesting and engaging episode of the podcast. We have 3 women who are in leadership here at Doctor's Hospital talking about their experiences being women in healthcare and particularly being in leadership in healthcare. May is obviously a month that's all about women. We have Mother's Day, we have Women's Health. So it felt only appropriate to have this kind of a conversation with some of our women in leadership in the hospital space. So I am proud to welcome to the show this morning our Director of Infection Control, Dr. Ericka Thompson, our Director of Rehabilitation Services, Dr. Kereen Sherwood-Wallace, and our Director of Outpatient Clinic Operations, Patient Intake and Registration, Sherzel Smith. Sorry, the title was long. I had to give that for flair. All right, so welcome to the show, ladies.
Thank you.
Thank
All
you,
right.
Alexis.
So we can try to keep it light. It's some interesting questions that we want to go through and hear about your experiences in navigating the healthcare workspace. So to get started, I like to do background. And I imagine there's a lot of interesting stories in the room as how you all got to where you are. So we'll just go clockwise around them. So we'll start with Sherzel. But I want each of you to just share a little bit about your journey in healthcare and how you kind of, ended up in the role that you're in now, what led you to that space, whether it be in Doctor's Hospital in particular, in healthcare in general, or just the particular nature of your role. So Sherzel, we'll start with you and we'll go around.
Okay, no problem. So for me, I actually am an epidemiologist by training. So I did my bachelor's and master's in epidemiology.
Mm-hmm.
And so I was actually more in the research space before I came to Doctor's Hospital. So,
For our listeners, what is epidemiology?
so basically, it's the study of just disease transmission
Okay.
in populations. And so I've always been interested in health from like a macro perspective.
Mm-hmm.
Then I came home in, I think, 2019, and I came to Doctor's Hospital. So this was right before the pandemic. I came as a manager for projects. So I was working on specific projects in the environment.
Mhm.
And then we got thrust into COVID, which no one planned for that. And then that's when I transitioned mainly into working into our COVID testing business. So I'm sure if you have any local listeners, they would have remembered when Doctor's Hospital had all those testing sites. We were doing drive-through COVID tests, rapid antigen testing, PCR testing. So I dealt mainly with sort of the IT setup for that and then
Mhm.
sort of how that operation ran. And so that thrust me into that space. And then we kind of exploded in sort of the outpatient market after that. And so I just naturally gravitated towards that space. And I
Mhm.
guess Doctor's Hospital felt it was appropriate to have me direct in that space. So that's basically how I got to where I am now.
The evolution. Dr. Thompson?
For me, I am a registered nurse by profession, joined that noble profession in 1996. Because of my love for science, actually. I originally wanted to be a scientist. And my mom was like, "Where in the Bahamas? What will you do? What job would you get?" And so I said, you know what? Since I like the human body, let me seek a career in nursing. So I did that. Graduated from the College of the Bahamas in 1996 with Associates of Science in Nursing. Went on to pursue a Bachelor's of Science in Nursing with the College of the Bahamas the minute it came available.
Mhm.
And that's where my career began in Doctor's Hospital. Seeking to advance my degree, I joined Doctor's Hospital team as a part-time worker then, and 1 year later became full-time and transitioned through the organization as a hospital supervisor,
Mm-hmm.
a former AVP of nursing. And one night, the Heavenly Father told me, go and do some research
Mm-hmm.
in infection control. And that was a few years before COVID. And I was like, okay, someone else is going to need this, but this isn't me.
Mm-hmm.
I'm a nurse. And ironically,
Lo and
my
behold.
job role was changed to director of infection control. So I only smiled when that position was given to me. And I said, Lord, you have a great sense of humor.
Mm-hmm.
But it was in preparation for COVID, which came many years later. And so now in that role, I have obtained a doctorate degree in nursing because that is still my passion.
Mm-hmm.
And infection control has just interwoven
Mm-hmm.
within that. And so that's me in a nutshell.
Yep. Dr. Wallace.
So for me, I started out at Doctor's Hospital at a very tender age of probably like 22. I just graduated from the University of the West Indies as a physiotherapist,
Mm-hmm.
and when working there, is like, what does the world has to offer? You know, what else is there? And I decided to kind of venture out. And my first stop, my sister was here in the Bahamas, and I came over. She was working at Princess Margaret, and Doctor's Hospital, was recruiting, and I came and I worked as a physiotherapist. I would have been in 2007. And so, working as a therapist, I was always interested in just growing as a person and growing and developing. And I furthered my studies, did a master's in sports and exercise medicine, and then a doctorate in physical therapy. And, I've been working in different private institutions on the island, did a stint in pediatrics and neurology, worked also a lot with sports and
Mm-hmm.
with the BOC and the B3As. And ultimately, just by chance, I got recruited back to Doctor's Hospital, when doing a presentation. And as Miss Evans has said, Evans Thompson has said, I believe everything is ordained and you're put in a position, God puts you in a certain position to take you on a particular journey, and that has led me to, the director position in rehab.
And follow me for a second. What year did you return to Doctor's Hospital?
Return,
Mhm.
2021.
Yeah. So it's interesting because a lot of us kind of have that COVID
Mhm.
connection because I think Sherzel, I came in maybe about a month or two after you did.
Mhm.
And then obviously how that ties into you, and then
Yes.
obviously you're coming in kind of right during the height of it. So it's always an interesting connection. I think that's going to be a through line for a lot of people in the medical space going forward. So let's start to dig a little bit deeper because we talk about women in leadership a lot. It's a conversation that goes on in a lot of different spaces, particularly some of the challenges that people feel like they face. So I'll leave this one open for whoever wants to respond. But what unique challenges have you faced as women in healthcare leadership, and how have you overcome them?
I could start. For me, as I got older, I didn't have as many challenges. I found that when I was younger and as a female in the medical space,
Mhm.
they didn't tend to respect you as well as they would respect the men. Like all the males in the hospital, they looked at, oh, doc, they call him doc.
Mhm.
But you as a female, you're a nurse
Mhm.
or you're. So yeah, that was most a big challenge for me. Like when I was younger, and because you graduated younger too, they
Mhm.
tended to think that you weren't as capable, you know. Yeah, so for me that was my challenge early on.
All right. So moving forward, in what ways do you think that gender has influenced your leadership style or approach?
I can probably take that one. So I mean, I'm a woman. I don't have a families. I don't have kids,
Mm-hmm.
but I have a lot of staff who are women, and I have leaders as well underneath me who are women.
Mm-hmm.
And I think the Bahamas is a unique environment. So I've worked in the U.S. I've worked in Amsterdam, and the Bahamas is unique in that women tend to take on a lot more leadership roles.
Mm-hmm.
We're better educated. And what you're seeing a lot of the times is that the women also still have the load of the home. And so for me, as a leader, I have associates underneath me who have to balance work, they have to balance family. In some cases, women tend to be caregivers. So if they have older parents or ill parents, they have to deal with that. So really, I think for me, that's me knowing what that means, I'm able to better be able to support my associates. And so obviously not saying that men can't support as well, but I think as a woman, we kind of more understand those kinds of needs. We're more sympathetic to those kinds of needs. And so we're better able to make an environment for our teams that are conducive to that.
Right. Anybody else want to add?
I would agree with Mr. Smith as well, because for me, I think as a woman, I'm more empathetic as well. And not only to my female associates, but also my males, because it's a family atmosphere. And Doctors Hospital promotes being a family orientated organization. And so, even just coming from a meeting today, my what I put forward to them is, tell me how you would like to work according to your busy life schedule to make that life balance. Give me shift times that we as leaders can discuss and come up with the best shift times to accommodate you, our associates. And I think even in doing that, we get more even out of them and build commitment.
Okay. So taking that a little bit further, because I know both of you kind of talked from the standpoint of almost and I don't want to say this in a way that comes across as degrading, but as almost taking on like a mother figure role as you lead your teams. And obviously part of that would come into the space of mentorship, right? And so kind of reversing the conversation a little bit, how crucial is it for you in terms of people who've operated or acted as mentors in your life? How critical has that been as you've navigated? Obviously, everybody's talking about a lot of different changes and moving around, from Amsterdam to the US to home, working in a lot of different private spaces. What does that look like in terms of mentorship through that experience or through that journey?
So I would say for sure, I mean, I have a number of mentors, throughout my career. And I think I would have mentioned there are some elements of my career that came by choice, but also some where I was kind of thrust into it, COVID being the best example. And so definitely having access to other women leaders, both in the Doctors Hospital environment and outside of it, has been absolutely pivotal. So I think that's a huge part of it. And just having someone to sort of bounce ideas and questions off of. And, Doctors Hospital as an environment, we're always pivoting, we're always changing. And so there's always a new project. And not just that, but there's always something to respond to and have to make a decision on.
Yeah.
And so I've definitely reached out to my mentors to get feedback on, how do I navigate this decision? Or how do I navigate this problem or this issue? So for me, that's been a huge part of my career in getting to this point for sure.
I can agree with Ms. Smith as well. Mentorship is very important in this leadership role. For me, my greatest mentor was my mom. She was the person I did bounce ideas off. And when I lost her, I had to begin to look elsewhere for other leadership, women in leadership roles and outside of healthcare. And I have obtained 3 other mentors who really support, guide, and lead. And most of all, my greatest mentor and confidant and counselor is the Lord God Almighty. Because through COVID, like I said, a great sense of humor. It was do this, do that, and talk to this one and talk to that one, so that Doctors Hospital and our nation as a whole would have been saved.
Oh, yeah. I remember sitting on the other side of a lot of emails about hand washing signs, wear your mask, and sitting on the, like I said, the other side of a lot of emails from you about making sure we had our information out there and all through that, and even now, obviously continuing, even with COVID being mostly behind us, it's still important to manage that in this space. So yeah, I still get emails now about hand washing signs and things like that. So,
yes. It hasn't gone anywhere.
Right. Kereen, you want to add to that?
I think my perspective is a little different. Most of my mentors, as I think back, have been male. I find that, I don't know if because I think I'm a little tough sometimes, and I don't get as, I'm not as, I don't want to say touchy feely, but
As I sip my tea.
so I find for me, it's like I'm always looking for some guidance in terms of strength and resilience.
Mhm.
And sometimes I feel like females, if they tend to become very territorial when you're looking for that strength from them.
Mhm.
So sometimes that has been an issue. Um, so yeah, I think for me, I do have mentors, and it's very important to have mentors.
Mhm.
Um, but yeah,
Yeah, it's interesting the different dynamic of it, right? And I only sip my tea because yes, you can be rough.
I'm
But
working on my nurturing.
no, I know, but I think
So
I'll,
it's not
I'll,
only me.
I'll be
I'm
honest
working
with
on
you
it.
though. You know, I think it's interesting because obviously as the only male in conversation, I think it is interesting to sit on the other side of strong women, especially in leadership, because there's almost it's there's an innate thing of how people respond, right? Um, and we were talking about this a little off air before the podcast started. I'm not going to delve into that conversation because that may be problematic. But what I will say is, I think it is interesting how people perceive and then therefore respond to leadership when it comes from different spaces, especially when it comes from different genders. So I think there is some of that kind of trying to figure out how you interact, how you engage, and being kind of respectful, responsive, and then learning how to work together in that environment. Because I imagine there's a lot of men who have challenges with working alongside or even under female leadership. And I think that's a process to walk through. Just because I think just how we are innately designed to have this idea of, well, the man is the leader, and that's kind of how a lot of people view it. So it's interesting to kind of, just think through that process. So kind of pulling back a little bit, there was something that Dr. Thompson mentioned in your answer to one of the earlier questions. Self-care, work-life balance, I imagine it's important for everyone. But especially in a leadership position in an organization like ours, which is a mile a minute, there's always like we got emails on the weekend about something else that we need to urgently go and start to get off of the ground and things like that. So how do you prioritize self-care and how do you try to maintain a healthy work-life balance, especially for those who, do have the family component of it? Not saying, but the idea is, especially when you start to have spouse, kids, what does that look like?
Well, I guess for me, something that's big for me in terms of my self care is that, I have to work out 4 times a week. And that's a commitment that I've made to myself. And so far I've been successful. And how does it work? So for me, you know, for instance, today I've already put on my calendar the time that I'm going to the gym.
Mm-hmm.
Even if there are moments during my workout where I need to check my phone or I need to step out, right? I'm fine with that. I understand that that's what this role requires, but I'm going to go. I'm going to go there and I'm going to get a sweat in. So for me, that being committed to that and not being sort of the time for me has been a big deal for me.
Mm-hmm.
Yeah.
For me, self-care, I know so well. Having gone through health challenges myself, it really made me take better care of myself. And for me, that means rest, relaxation, that cut off period. Like you have 2 cell phones, one is work, but I would say both is work. So that means cell phone on silent for that hour, 2 hours, or whatever time in the day. I'm usually available 24/7 because of the role I play, but I have that cell phone cutoff time.
Right.
And for me, it's to trampoline. So I have one set day that is set aside for me and my grandkids. And so me and my grandchildren, that will begin with breakfast, me cooking, of course, a trampoline, basketball game I've never won. Okay, but I intend to get better. Okay, and then whatever they intend to do for the day, I am just theirs. And so that is my really rest day, relaxation, and of course reading.
Okay. So when I think of self-care for me, in the rehab space, we tend to be advocates of, exercise and fitness. So there's that component that's always in the back of your mind. Oh, you need to go for a walk, you need to do that. For me, I think it's important to kind of detach from work and, just kind of lose yourself in something different. So I like to do quiet time karaoke. Just
Okay.
make it noise in the house. Just be, with YouTube karaoke. But that really helps me. But also another important part of self care is to realize when all those balls you have juggling, whether it's my 6-year-old, my husband, duties as a wife, or work. Just realizing when I need to stop with one and start to focus more on the other, just to kind of make sure everything is kind of kept in balance.
Yeah, I think the interesting thing, and obviously we exist now in a time where self care is readily discussed. Work life balance is also a heavy topic of conversation. And I think you're right. It's finding that time to say this is either just me time or just family time, and separating from what can be a very hectic and demanding environment. All right, so great conversation thus far. We'll take a quick break for words from our sponsors, and then we'll be right back with the Doctor's Hospital podcast.
This Mother's Day, treat mom to a day of love and relaxation at Doctor's Hospital Rehab. Enjoy our Day for Mom, Day for Love promotional offers. Indulge in a soothing 60-minute prenatal massage or unwind with a 60-minute rejuvenating postpartum massage, both for just $80, or secure 5 sessions for $325. You can also share precious moments with your little one with our Mummy and Me massage. Enjoy the 60 minutes of relaxation for $120, or book 5 sessions for $500. Or stay fit and connected with our Mummy and Me workout program, designed for mom with babies aged 3 months to 1 year old. Join for $120 per month, 1 session per week. Doctor's Hospital Rehab Services, rebuilding together.
All right, welcome back to the Doctor's Hospital podcast. We are picking up our conversation with Dr. Kereen Sherwood-Wallace, Sherzel Smith, and Dr. Ericka Thompson, talking about the experience of being women in healthcare, particularly in healthcare leadership. So let's look forward. We talked about mentorship a little bit before. So let's look at, kind of paying it forward in terms of how you engage with other women or young women, and what advice would you give to other women who may be looking to, potentially fill some of the roles that you're sitting in today, or we're just generally looking into getting into healthcare and potentially into healthcare leadership?
My advice to young women who would want to get in healthcare leadership could be wrapped up in one word, or I would say 2. Dream big and go after your dreams. Nothing good comes without commitment and hard work. And it would require you to actually investigate, see what avenues, what degrees, what is expected in the role you aspire to get. I have younger nurses coming and asking me, what did you do to get here? And I said, I was committed, determined, and focused. And so that's what I would advise them.
Okay.
Yeah, I would say, and you asked about leadership positions. So you asked persons aspiring to leadership, not necessarily just working in healthcare.
Right.
And I think really the difference is, quite frankly, anybody can show up and just fill out a job description and do the job. But I think the persons who sort of step out of the box and think about other ways they can contribute, ways they can improve their environment, ways that they can, and especially in our context, we're thinking of ways how we can expand access to care, right? I think that's sort of the defining factor. And so I would say, just like Ms. Thompson said, Dr. Thompson, how are you going to show up and show commitment? How are you going to show what you're going to contribute, separate and apart from just showing up and doing a job?
Right.
Leadership is a journey. So
Yes.
I would say figure out who you are at the beginning of that journey. A lot of times we don't spend enough time getting to know ourselves, our strengths and our weaknesses. And I think that's a big part of being a leader, you have to know yourself and be able to impart, some good advice and help to others that you have to lead.
Hmm.
Knowing when to say, okay, I was wrong, or
Right. So yeah, I think that's a really good one, because if you instead of letting yourself be defined by being a leader, you ought to define who you want to be as you then step
Right.
into leadership. Because if you say, this is who I am, so this is who Kereen is when she walks into this space, this is who Ericka is when she walks into this space, this is who Sherzel is when she walks into the space, then people know what they're gonna get. They know who the person is, they know what you stand for. I think it's an interesting thing. We talk about core values a lot within the health system. And I think one of the points that Dr. Diggers always makes is, what are your individual and personal core values?
Yes.
And when you know that, then it makes it easier to then operate as a leader, because you're not swayed by, well, I'm a leader now, so you don't
Right.
kind of get into that sort of space. So I think it's a particularly good piece of advice all around. All right, so going back to the conversation around the pandemic. The pandemic brought about unprecedented challenges to the healthcare sector. How do you feel like you've navigated the leadership challenges brought on by COVID-19? Because obviously, Sherzel, you talked about kind of being thrown into the fire a little bit, and all of us kind of had to figure out how to navigate through it. But
Yeah, I would say probably, just innovation. So
Yes.
nowadays,
Yes.
and we could even talk about the doctor's hospital environment.
right,
There was a point in time where all of our meetings we were doing in person,
Mhm.
and now
Mhm.
we're mostly doing them virtually
Virtual, yes.
post COVID, and because we have so many locations, and so we
Mhm.
had to
Mhm.
think differently, quite frankly.
Yes.
Oh, yeah.
And there were lots of times where we were sitting in the conference room, obviously socially distanced,
Mhm.
and you were in some of those
Mhm.
sessions as well, where we had to sit and sort of innovate and think, how are we going to make sense of this, and how are we going to continue to provide the services that our patients need?
Right.
And so I think that ability to just sort of sit down, think about all the resources that we have available to us or can make available to us, and make something of it. And I mean, that ended up becoming, I think we did maybe 2 million COVID tests during
Right.
the entire pandemic, which is huge.
Mhm.
And that came out of literally just as leaders sitting in a room brainstorming and figuring out basically.
Yeah, that was, I think the most interesting thing about that for me was the fact that we were doing COVID testing on the upper parking level at Town Center Mall,
Mhm.
which seems like a lifetime ago
Yeah.
now.
Mhm.
But also I think there were a lot of heavy conversations that I think especially for you and Ericka would have been involved in at the time, about things like visiting hours.
Yes.
Are we closing certain entrances? All of those sorts of things.
Providing testing to the visitors.
Right.
That's definitely something that
Mhm.
Yes.
Erica and her team were pivotal in sort of shaping what that looked like to keep our patients safe.
And that's the thing. A lot of those conversations both existed at the micro level of Doctors Hospital, but also at the macro level of the nation's response
Yes.
to that. I think innovation is definitely, I think, a strong answer. Anything else? Anybody want to add to that?
And it shows pivoting.
Mhm.
So we had to pivot today. What was current today in the morning was old
Old
news,
news.
and you had to pivot and change immediately
Mhm.
in order to keep up with what was going on
Right.
globally.
And that's the thing. I think a part of the conversation that came out of COVID-19 was how much more people needed to really engage and invest in primary care. And that became a global
Yes.
conversation. So obviously for us as a hospital, that is a part of the reason why the expansion efforts into all of these different clinic spaces became our modus operandi, because that was just where healthcare was going, and the realization of how many challenges existed for people who had comorbid conditions when they got COVID. And it's just like, but if we get ahead of that, if we're able to catch things earlier, if we're able to get people into treatment protocols earlier, you have the potential of curbing, the debilitating nature of what COVID did for a lot of people. Kereen, anything?
For me, there are a lot of lessons in how to be a nurturer
Mm.
and how to actually be more empathetic
Mhm.
towards the staff and the challenges that they would have, because going in, going into those rooms sometimes wasn't an easy task. Sometimes having to tell them, okay, no, you came to work here, but no, you have to go out west to work, and it's that being fluid and being able
Mm-hmm.
to pivot that was
Yes.
difficult. So that you know helped to strengthen us as a team, I think, and even the wider doctors hospital helping us to work better as a team,
Yes.
Right.
and
This
connect in that way.
this therapy would have been a big part of our treatment approach during the
Right.
pandemic as well. Okay. So you know, everybody here comes from a slightly different background, and you work in leadership of people who come from a lot of different backgrounds in terms of their relationships, their upbringing, their attitudes toward work, all of these sorts of things. How do you foster a culture of inclusion and diversity within your own segments of Doctors Hospital? Because I imagine there are a lot of different types of folks that everybody's kind of engaging with on a day-to-day basis. So how do you kind of foster that culture?
So I think a big part of that is listening. So really listening to your
Mm.
team. So while you mentioned they all come from different backgrounds, everyone also has their own challenges they're dealing with
On a
even
day-to-day
outside
basis.
of the
Mm-hmm.
workplace. And so I think, having those check-ins with your associates is huge. And then even on the point you mentioned about gender, right? So I have much more female associates than I do male,
Mm-hmm.
right? But even then, I can see that their responsibilities are different, right?
Mm.
And especially when it comes to things like home and family, and so
Mhm.
definitely making the allocations necessary so that they're able to do what they need to do for their families, whether
Mhm.
it's regular school pickups. Okay, there's a child who's ill, you
Right.
have to attend to that, and that doesn't hurt their ability to be able to move up in the organization.
Mm-hmm. It's good.
For me, with my team, I would agree with some of the things Sherzel said as well. For me, it is making every voice matters and
Mm.
every voice counts.
Mm-hmm.
And so for that, I give them an opportunity every morning. We huddle as a
Mm-hmm.
team. And during that huddle, we would highlight personal and professional goals and aspirations. And whatever the associates would wish to share would be shared at that time as well. And like Sherzel said, being flexible,
Mm-hmm.
treating each individual on an individual basis,
Right.
still accomplishing the organization goals.
I think Doctors Hospital does a very good job. I can speak from being from a different culture, although
Mm-hmm.
it's still Caribbean, but it's
Mhm.
still different. And we have people from all over the world working
You
at the
sure do.
hospital. I
Mhm.
think we do a very good job.
Yes.
In my small corner, I think we do a lot of team building activities that are
Mhm.
staff led. So I can remember the last one we had was a food fest, a mini food fest
Mhm.
where we had Indian food, Haitian food, we had
Right.
Jamaican, just a melting pot of the different cultures. So that was I think because we are in such a heavy space, the
Mm-hmm.
fun aspect, where everybody gets to let their guard down, that's
Mhm.
very
Mhm.
important.
Well, I always tell people rehab is the fun department in the hospital.
Oh, yay.
But you're right though. I know we've done even the thing you mentioned as a department. We've done it as a hospital in years past where we've had
Right,
Yes.
I
like
remember
a
that.
mini international
Mhm.
food
Mhm.
festival
Yes.
right in the courtyard
Mhm.
where people of different cultures were able to come and you could
Mhm.
sample the different types of foods and stuff like that. And you're right, there are a broad diversity of
A
cultures
lot.
represented in the hospital space because we have people from all over the world
Mhm.
that work in our environment. All right, as we move towards wrapping up, I think this is a question that we've asked a few of our guests over the past few months. I think it always leads to interesting answers. So can you share a particularly rewarding moment or achievement from your career thus far working, whether it could be in Doctor's Hospital, it could be just generally speaking, but something that you look at and it's like, I felt like it was worth it in this moment.
I think for me, probably would be the vaccination campaign
Hmm.
in the Bahamas. And so there's a whole story behind that, and I won't get into the details, but essentially, Doctors Hospital was called upon to support, with IT and operations
Hmm.
for the initial rollout of the vaccine. And
Mhm.
so we were on the ground, we designed the platform, we were on the ground on the first day at Loyola Hall where the vaccines were issued. And I think for me, and I think everyone would agree, COVID felt exhausting. And it kind of felt like, when is this going to
The
end?
yeah.
And I think that day, I remember that because that was a Sunday. And I think for me, that's when it really felt worth it. Like, we've gotten to this point. Now we just got to get people vaccinated and we can maybe see an end to this. And so I feel very proud that I was able to be a part of that. And, you know, I think COVID was a tragedy for so many Bahamians. So many persons lost loved ones. And so for us to support in getting our society to a space where persons are vaccinated and we're able to move around and interact similarly to how we did before the pandemic, that's something I'm pretty proud of.
For me, I would say the impact on young nurses. So through our nursing intern program, to see them successfully complete their nursing council exams and achieving 100% pass rates in some of our nursing intern cohorts was a great impact, because to me, that's the future of the profession, and Doctors Hospital helped them get there.
Yeah, legacy is an important thing.
As I reflect, I think I was able to be a part of the women in sports commission. That's international Olympic Committee led program. When they first started that was something pivotal for me, and to be able to travel with the Bahamian team coming from another country to go to the Olympics and work with the athletes, that was something big for me, in my leadership journey, because that's a more male-dominated field, in sports.
So that's awesome. Yeah. Got to go to the Olympics. Cool. All right. So last question for everyone. What message would you like to leave with our listeners, especially those who may be women striving to make an impact in healthcare?
That's a good question. I think in the Bahamas, as I said before, women really step up to the leadership plate a lot more than I've seen in other cultures. So I definitely think, what we do in our society and our support for women leaders is excellent. However, I would say for persons who are, striving to make an impact, I would say, sit down and think about what your passion is and where you find your niche and where you can contribute. And I think, we need more of persons contributing in their special strengths, right? And I think that's something that when we've seen that happen at Doctors Hospital, I mean, huge things have occurred.
Right.
And that's at all levels. I know people tend to focus at the, director, VP, etc. But we've seen this, at the supervisor level, manager level. And I think the second thing, at least for me, is embrace all steps of the journey. So leadership doesn't happen overnight, right? And if I think back on it, this journey had many different seasons, some of which I missed the certain aspects of them, and some of which I'm like, oh, I'm so glad I got through that. But I still had to go through it, right? And so I would say embrace every element and every spot that you're at in your season and be willing to do the work to get that growth.
Awesome.
I would say, just similar to what Sherzel says, lead from where you're at. Be passionate with what is given to you and do your best. Even, I often say, give 100%, but for me, it's give 200%. Okay, so you lead from where you're at and continue on that journey. And as you move up, and you would want to make an impact wherever you are on that journey, and advocate for others.
I would say one pivotal thing for them to know is you always need to be grounded. So you need to have a base of, a community of persons who will tell you when you're wrong and when you're right, that soundboard to be able to guide you. Because a lot of times I find that leadership is lonely. It can be lonely. Not everyone would understand what you're going through. So having someone to be able to talk to, or having that community of persons around you that you can trust and that will give you, good advice, not tell you what you want to hear, but what you need to hear. So, yeah.
Awesome. So I want to thank you all for an amazing conversation. I think a lot of interesting and diverse backgrounds and experiences along the way. And I think this is something that will be very beneficial for our listeners, especially those who may be interested in stepping into just healthcare in general, and definitely those who aspire to leadership in this space. So I want to thank you, Sherzel, Dr. Thompson, and Dr. Wallace, for joining us today. It's a pleasure having you.
Thank
You're
you.
welcome.
Enjoy
Thank you
being
for having
here.
us.
All right. And for our listeners, as always, we invite you to like, comment, subscribe, and share. And we will see you back here next week on the Doctors Hospital podcast.
Doctors Hospital is reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.